Opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I'm your host, Louise Gomez. Welcome back to the show. And today we have Dr. Zahra Khan, who is a general surgeon right here in Palm Beach Surgical. She's part of the Palm Beach Health Network at 16215 South Jog Road, Suite 204, Delray Beach, Florida 33446. You can reach her directly at 561-448-3848, and the website is palmbeachhealthnetwork.com. And I am going to read part of her bio because you have a very extensive bio, and I want to make sure everybody gets to know who you are. And so Dr. Zahra Khan is a fellowship-trained endocrine surgeon with Palm Beach Surgical, a general surgery practice with Palm Beach Health Network Physician Group in Delray Beach. Dr. Khan is on staff at Delray Medical Center, and she specializes in thyroid cancer, parathyroid disease, thyroid nodules, adrenal tumors, functional adrenal adenomas, calcium disorders, and Graves' disease. Dr. Khan completed a fellowship in endocrine surgery, served as chief administrative resident, and completed her general surgery residency at Jackson Memorial Hospital University, part of the U of M healthcare system. Dr. Khan graduated medical school from the University of Miami School of Medicine. Prior to joining her organization, Dr. Khan worked as an instructor at the University of Miami School of Medicine. In addition, Dr. Khan has presented her medical research at regional, national, and international general surgery meetings. Dr. Khan is a member of the American Association of Endocrine Surgeons and the American College of Surgeons. Welcome to the show.
Thank you.
That's quite impressive.
Thank you for having me.
Of course. Very, very impressive. So we know a little bit about your background. Can you tell us a little bit more about the endocrine system? Because we hear that, we know it, but you know, now that you're here, let's kind of address the whole importance of it and overall.
Sure. So, you know, the endocrine system is, it's the system in the body comprised of glands that produce hormones and release them into the bloodstream. So it governs lots of functions in the body, and it really has a huge impact on how people feel. Like, it's part of our everyday life, the hormones that, you know, that are in our bloodstream. But I am an endocrine surgeon, so I deal with surgical disease of endocrine glands. So I primarily operate on the thyroid gland, the parathyroid glands, and the adrenal glands. So, you know, I don't really deal with the function as much insofar as only, you know, if a patient requires surgery. For example, if they have a hyperactive thyroid nodule or thyroid disease that's not amenable to medical management, or thyroid cancer, things like that.
So if we could just take a couple of steps back and say, like, if someone's listening right now and maybe they're a little concerned and they're not sure and they want to see an endocrinologist, what do you think they would be feeling or experiencing, or what should they do next if they're having these types of issues?
Well, in general, I think the best place to start is with a primary care physician. I know that, you know, it's it's hard for a lot of people to establish a relationship with a primary care doctor, but I really do think that's the, that's the first place to start,
Right.
With any kind of concern
Sure.
that you have, because that way a basic set of blood tests can be done. Sometimes these disorders are found through blood work. And just having those basic tests done and can determine whether there's an issue that is related to the endocrine system, and then help create a referral to an endocrinologist so that the treatment is a little more streamlined.
That makes sense. So what are some of the common medical conditions that may require endocrine surgery?
Well, the most common one is thyroid cancer. So I deal a lot with thyroid nodules, nodules that are suspicious for cancer or confirmed to be cancer with biopsies. I also deal with thyroid nodules that are so large that they are causing symptoms like difficulty swallowing, breathing, or just discomfort. The other disease that I treat is parathyroid disease. Parathyroid glands are behind the thyroid and they control calcium levels in the body. So when people have overactive parathyroid glands, they produce too much PTH, which leads to very high calcium levels, and that can cause problems with the skeletal system and the renal systems.
Could you elaborate the difference between a benign and malignant endocrine tumor?
Sure. So, I mean, benign versus malignant is, you know, an issue that comes up with lots of different tumors. But for endocrine specifically, that would be that would refer to cancer of the thyroid. So a benign tumor just means that the cells are normal cells, even though they are proliferating more than they should be, growing larger than they should be, that it essentially is confined to the gland and, you know, not malignant, not cancerous. Cancerous cells are, you know, they're abnormal. They have the capacity to spread beyond the thyroid gland to lymph nodes and distant sites if left untreated. Parathyroid cancer is extremely rare, a very rare entity. Most parathyroid disease is not cancerous, you know, it's benign. And adrenal disease, also very rare in general, but...
Is that Graves' disease?
Graves' disease refers to the thyroid.
Okay.
So Graves, I think you're thinking maybe of Addison's
Oh,
disease.
maybe, yes.
Addison's disease. A lot of these diseases are named
Yes.
by certain, you know, people, either physicians or the first patient that was known to have it or became famous for having it. So no, but Graves' disease is something else. It's an autoimmune condition of the thyroid where the body attacks, you know, has antibodies against the thyroid, and it causes the thyroid to be very hyperactive. Most people take medication for, you know, for a period of time, and they're treated medically, but in rare cases people don't respond to medical therapy, and those are the patients for whom I would operate on to remove the thyroid gland, to remove the, you know, the root cause of the disease.
I was going to ask you, Dr. Khan, is this more prevalent in women than men, or I was just thinking that for some reason. I feel like
that's a great question.
We have these challenges as females.
No, it's a really good question. I think people do associate thyroid disease with women more than men, and that is for a good reason, because it's twice as common in women than it is in men.
Yeah, I kind of thought that, because I know I seem to hear a lot more women in my circle of people that have had these types of challenges. So. So what are the primary treatment options for endocrine disorders? So, and when would surgery be recommended?
So with respect to the thyroid, you know, there are various conditions that are, you know, that can affect the thyroid. I think the most common one is really just hypothyroidism, where the thyroid doesn't work enough. A lot of people are afflicted with that, and it's not a surgical disease. The treatment is simply to take a medication, a hormone supplement to substitute the function that the thyroid should have, and that's just tested by, you know, the levels are kept normal by dosing the medication according to the blood test. The other condition of the thyroid that is very common is just having a thyroid nodule, an abnormal tumor that's growing within the thyroid. And the vast majority of nodules are benign. You know, if they're benign and they're small and they're not causing problems, then that also is just something that just needs to be watched and surveilled to ensure that the nodules are not changing or growing in any way. Sometimes nodules, in rare cases, are not benign, and they do harbor cancerous cells, and in that case, then surgery is the best option. It's really the, you know, the only option.
Sure. Is this like a genetic challenge, or is this, what are they thinking about this? Is this genetic, a lot of these?
So definitely there is a genetic component to this. Not the vast majority of people that have thyroid nodules or thyroid cancer do not have a family history of it. It's not in their genes, but there are, you know, there's a good proportion of people that do have it in their genes. And, you know, over the past like 10, 20 years, we've started to learn some of the genes that are associated with thyroid cancer, and there are even a few syndromic conditions where thyroid cancer is associated with other diseases, and so we know that those are genetic, have a genetic component too.
Yeah, there's just so much, there's so many studies, and there's so much of a, with genetics. I feel like they've learned so much with all these tests and just the technology that they have today.
Absolutely.
It's amazing to me, right?
It is.
What do you foresee as the future of this as far as AI or technology? Do you think that you'll have better results or better types of outcomes?
Yeah, well, I'm not sure about the role AI will have in terms of endocrine surgery or endocrine disease, but I do think that it's an exciting time in medicine, and we are learning more about genetics. Over the last several years, genetic studies have become very common in terms of understanding this, you know, the cytology of the of what we get from the thyroid nodules. Because to determine whether a thyroid nodule is cancer, people undergo a biopsy, and the biopsy takes just a few cells, just with a really tiny needle. And now we have a battery of genetic tests that we can perform on those cells with just the tiniest cell, you know, to determine the risk for cancer. And it's still a bit of a gray area. There's no 100% guarantee with that, but I think that the technology is getting better, and the hope is that, you know, those genetic studies will be more and more accurate as time goes on.
We're going to take a quick commercial break, and we'll be back.
Okay,
all right.
Great.
Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in to You and Your Doctor. We are here with Dr. Zahra Khan, and I'm finding this conversation so intriguing. Actually, let me give your address real quick. You're at 16215 South Jog Road, Suite 204, Delray Beach, Florida, 33446. And the phone number is 561-448-3848. And I'm really finding this intriguing, fascinating conversation. What type of collaboration do you have with other specialists? I'm sure you have to work with multiple doctors. How does that work?
Yes, absolutely. So I primarily work with endocrinologists.
Okay.
They are usually the ones that would diagnose someone with, you know, a hyperfunctional thyroid secondary to Graves' disease that's not amenable to medical management, or they will discover thyroid nodules leading to, you know, a thyroid cancer diagnosis. And I work very closely with them to manage thyroid cancer. Generally with thyroid cancer, we don't, you know, it's a very special kind of cancer in that we don't send the patients to medical oncologists usually.
I was going to ask you that. Okay.
Thyroid cancer is mostly treated by endocrinologists. It's very specialized.
Okay.
And that's because thyroid cancer doesn't really behave like other kinds of cancer.
Interesting.
You know, chemotherapy doesn't really have a role in most thyroid cancer, the vast majority of it. External beam radiation isn't a part of it for the most part. So in terms of surveilling it or adjuvant therapies, the endocrinologist steps in and helps with that.
Okay. So what should people look for when choosing a surgeon for endocrine procedures? What do you think?
That's a good question. So I think that the most important thing is to find a surgeon that is very specialized, that does the same thing, you know, over and over again. That's an expert that has that level of comfort and with the disease condition, and you know, and is able to see every type of version of that disease that there is. And when a surgeon has very high volume, then you know they're going to be good.
That makes sense.
But really, I think another good thing to look for when you're finding a surgeon is talk to the patients that have been operated on by that surgeon. I think the patients probably know more. The patient is going to know more about the way a surgeon is than even other doctors.
Good point. Good point, because they're the end user at the end of the day. So what's a typical recovery process for a patient after endocrine surgery, and what type of follow-up care would be necessary?
So the type of recovery after thyroid surgery is actually, it's much better than people anticipate. There really isn't that much pain, and patients, you know, they have the option of staying overnight in the hospital the day after the surgery. I tell everyone to take a week off from work just to give themselves that buffer to recover from being in the hospital, having surgery. But for the most part, patients feel really back to their baseline within 2 or 3 days after surgery. They have no restrictions on their diet or their movement. And I really want my patients to be back to normal as soon as possible.
Yeah. So are there any lifestyle changes or considerations that maybe they should be aware of post-surgery, or it just, I guess it would depend more upon what type of surgery you're doing, right?
It depends, yeah, exactly. It depends more upon the initial disease that they're being treated for. But I think the most dramatic change for people is if they don't have, if I'm removing the entire thyroid gland, then they will require thyroid hormone supplementation for the rest of their lives. So they just have to, take a medication for the rest of their lives. But otherwise, there really shouldn't be any drastic changes between before and after the surgery, long term.
I have to honestly say, after speaking to you and having all this conversation, it's really, it's in my eyes, it seems like it's something that's manageable. I just was, you know, I knew somebody years ago that had to have a removal. She had cancer. And to me, I'd never met anyone that had that, and it was just kind of shocking and jolting at the time. I was much younger. But now, you know, you make it sound like it really is. I mean, just can function, you know, get the surgery, and then you'll be on, they would be on a hormone supplementation, right?
Right, right.
Just doing the job of what the hormone would, the thyroid would be doing. Is that right?
Yes, yes. I mean, it's true. You know, anytime you're dealing with cancer, it's extremely, you know, it's extremely stressful. It's very scary.
Sure.
Even with a cancer that has a high cure rate and that people do very well with, it's a lot to deal with, you know. But the thing that I really love about this, you know, this field is that patients with thyroid cancer, they do so well.
That's
you know,
great.
They really do achieve, most of them achieve a cure.
Nice.
Very rarely do they have a recurrence. Their quality of life doesn't really, isn't impacted by the cancer, and their longevity is very rarely impacted as well. So that just is, it's very gratifying to see that.
And it's hopeful. I feel like, you know, if patients do have this type of cancer, it's hopeful. When you said, you know, not a high case of reoccurrence, it's kind of like you feel like, okay, you get the surgery, you do what you need to do, and then you can go back to your, you know, normal life as much as you can.
As much as possible.
As much as possible.
Exactly.
Do you have any good story about a particular patient? I usually like to share, or maybe any good outcomes that you've had that maybe people have experienced, or any.
Well, I mean, I feel like I have so many different stories,
sure.
and, you know, thinking of all of my different patients.
Sure.
But I think overall the thing that sticks out to me the most is just, it's even, honestly, it's the first office visit, even more so than seeing patients after surgery. Just seeing patients come to me not really knowing what that thyroid cancer diagnosis means, being able to talk them through it, come to a common understanding, and seeing the relief on their faces, you know, when I explain everything to them and what they're going to experience. And then, you know, that to me is just that, so it's just very fulfilling. And then, you know, then of course, obviously after seeing patients, you know, after the surgery, like them going back to their lives, like, you know, feeling like themselves again, it's just amazing. I love it.
Well, you're definitely the right doctor to see. So if anybody's out there and you know somebody and you need to refer, you know who to call. So Dr. Khan, we have 2 minutes left. Is there anything you'd like to share, last thoughts you want to share, any tips or tricks, or what do you suggest for good thyroid health? What can we do?
Sure. Well, I think that it's important for everybody, you know, even if you don't have a family history of thyroid cancer, or you don't feel nodules yourself, you know, to make sure that you get your TSH checked, you know, every year. Get your thyroid, especially women.
Yeah.
Get your thyroid panel checked once a year, because thyroid disease is very common. And you know, as a baseline, do that. And then if you do feel nodules, or, you know, you notice a friend and you see their neck and you notice nodules, then alert them to that, and to make sure that they can get the proper workup, get the ultrasound, see if they need a biopsy, because thyroid cancer, even though it has a good prognosis, you know, it's still cancer, and it's very common in women.
Yeah.
And the earlier you catch it, the better it is. So
Absolutely. Thank you so much, Dr. Khan. Please reach out, 561-448-3848. She's right here at 16215 South Jog Road, Delray Beach, Florida. It was a pleasure. It was
so
a
nice,
pleasure
so nice
meeting
to meet you
and interviewing you.
Thank you so much for having me.
Absolutely.
Thank you for letting